Yeah. Hi guys, hope everyone is doing good. So today I'm going to present about the Guillain-Barré syndrome. Here, what is a Guillain-Barré syndrome? It is a polyneuritis condition mostly followed by an infection or a surgical illness. That means the nerves are getting inflamed here or inflamed here. And the pathogenesis or pathophysiology behind this is the molecular mimicry, which I'll be telling you further. So first, let us learn how the patient presents to you. Here, the patient presents with the weakness that usually starts in the leg, foot, followed by the thigh, and it progresses upwards to the upper limb and the trunk. So, which leads to the respiratory muscle paralysis, which is the dangerous thing that is a concern for us in the Guillain-Barré syndrome. So on examination, you will have the decreased reflexes. Here, see the example in the image. Here, for weeks back, the patient is having the gastroenteritis, followed by the symptoms, usually that are starting at the foot, then followed by the thigh, then it covers the whole leg, lower limb, then the upper limbs. So this is called the symmetrical ascending paralysis. This is the most important point you had to remember in the Guillain-Barré syndrome. So I'll just read it for you. Guillain-Barré syndrome. Here, the patient presents with symmetrical weakness that usually starts in the feet, followed by the leg, thigh, and it progresses upwards. And the patient may or may not complain of the loss of sensation and the pins and needle sensations. It is usually followed by an infection 4 weeks back. And on examination, the patient is having the decreased reflexes due to the nerve inflammation, that is a polyneuritis condition. So what is the pathophysiology? As I already told you, it is a molecular mimicry. Here, usually when a person gets infected, the antibodies are produced. So the antibodies should act on the antigen that is produced by the pathogen, that is the infective organism. But here what happens is our immune system, it thinks that the antigens or the proteins present on the myelin sheath as the antigens, because the antigens on the myelin sheath, they have the similar mimicry. That means it mimicries the antigen of the pathogens. So the antigen of the pathogen and the protein of the myelin sheath, they both share the same type of protein in it. So our antibodies not only act on the antigens of the pathogens, but also act on the antigens of the proteins of the myelin sheath. So it affects the protein of the myelin sheath, which leads to the inflammation or damage of the nerves. So how does this occur? So the major causes of this are the infective organisms or the surgical illness. So some common infective organisms are the Epstein-Barr virus, cytomegalovirus, and the HIV virus. But among these, the most common is the Campylobacter jejuni. Okay, and what is the diagnosis? So it's all about the nerves. So we had to do something related to the nerve, and the most common is the nerve conduction studies we do. So here the nerve gets damaged or inflamed. So there will be reduced signal. Due to this reduced signal, the patient is having that weakness and the paralysis. So it's a logical thing. It's a nerve condition. So we are doing the nerve conduction studies. And we are doing the lumbar puncture of the cerebrospinal fluid, because we need to rule out whether it's an infectious cause or some other causes. So here in the Guillain-Barré syndrome, this is a typical picture they usually ask in the AMC exam. So here the patient, as I already told you, it is a polyneuritis condition. P for protein, think as a protein, that is the raised protein, and N for normal cell count or the normal glucose count. I have added it in a next slide. So how do you manage? So it's usually a supportive care. Just give a symptomatic management like NSAIDs, or if the patient is having the pins and needle sensations, go with the gabapentin or tricyclic antidepressants or amitriptyline. But the first line management is the IV immunoglobulins. And to alternative to this, that is the second line, is the plasmapheresis. So the most important point they usually ask here in AMC is whether the steroids have a role in the GBS or not. So Absolutely, steroids have no role in the GBS, and you have to remember this because anyway we see the inflammation, we go with the steroids, but here the steroids have no role in the GBS. And what is the leading cause of death in the GBS? This is also an important question in the AMC. They usually ask this topic. This is the pulmonary embolism. So, the leading cause of death is a pulmonary embolism. So, VTE prophylaxis is very important in this patient. And as I already told you, due to the paralysis that is ascending upwards, the patient will have the respiratory muscle weakness, which can lead to the respiratory failure. So, the important or the most appropriate way to monitor the respiratory status in the GBS patient is the forced vital capacity. This is the most repeated question in the AMC. Usually, the AMC examiners like test you in a different way. Like they give the history, like 4 weeks back, the patient is having the gastroenteritis or some other illness, and now the patient is complaining of the weakness in the feet that started in the feet, progressing upwards, and now the patient comes with the respiratory distress, and on examination you have decreased reflexes, and you are suspecting it as a GBS, and they ask you like how do you monitor the respiratory status in this patient, and the answer should be the forced vital capacity. So I also wanted to mention some other question not relevant to this, but yeah, even in the asthma patient, they ask you the most appropriate way to monitor the respiratory condition or status in the asthma patient. It is the FEV1, that is forced expiratory vital capacity forced expiratory volume in the 1 second. It is FEV1 in asthma patients and FVC in the GBS patient. So when do you want to admit the patient? We have to admit the patient to the ICU. That is a 20-30-40 rule. That is, if the vital capacity is less than 20 ml per kg and the MIP is a mean inspiratory pressure less than 30 centimeter water, and MEP, that is mean expiratory pressure, that is less than 40 centimeter water. Whenever these are less or low, like less than 20 ml, less than 30, less than 40, that is 20-30-40 rule, you have to admit the patient. So I covered all the important points that have been asked in the AMC since so long, and these are the points you have to remember during your revision, and this slide is more than enough for you. So the characteristic features are the patient will have symmetrical, both limbs are affected, symmetrical ascending weakness that is progressing from the lower limb to the upper limb, and the patient will have the reduced reflexes. Okay, so what is the most common pathogen? As I already told you, it is a Campylobacter jejuni. Best diagnostic test? Yeah, it is nerve conduction studies, because the patient is having the nerve related issue. So what does happen in the nerve conduction studies? It is a problem with the nerve, that is the inflammation of the myelin sheath. So there is reduced signal, so the patient is having the weakness, paralysis and all. So LP findings, lumbar puncture findings. It's like you have to remember that point. I'm sorry. So you have to remember this point. So it's a polyneuritis condition, LP. I'm sorry for the trouble. So it's a raised protein. P for, see here the flow chart, LP findings, polyneuritis. This is how I remember for my exam. P for P, protein raised. N for normal glucose. Protein raised, normal glucose. At least remember N, normal glucose. The opposite is a protein raised. So only two components in the LP, that is protein and glucose. Remember one point, and it is exactly opposite. This is the most commonly asked question in the GBS topic. And the leading cause of the death, it is a pulmonary embolism. So VTE prophylaxis is important. And the first line management, IV immunoglobulin. Second line, it is plasmapheresis, steroids, no role. Most appropriate to monitor respiratory status in the GBS patient? Yep, it is forced vital capacity. These are the questions I have encountered, or these are the most common questions or topics that the AMC examiners wanted us to know. So like during your revision, just focus on these points, and I'm 90% or 100% sure that you're gonna answer in the GBS. And good luck, guys. Thank you.